day, viewers, and you're welcome to this edition of Sight Ed. Sight Ed is a sight educational program designed to educate every one of us on eye health issues, usually uniocular blindness. But then, when vision in one eye is gone, it can also have devastating effect. To talk to us about causes of ocular injuries and what we should do to prevent them, we have interviewed Professor Lawrence Onyekwe. Now the question is, eye injuries are often termed accidental, but are they truly always accidental? Or are there things we could have done to reduce our risk of getting injured in our eyes? Over to Lawrence Onyekwe.
I want to talk about eye injuries today. Mainly eye injuries, the causes, the prevention, and what we do, or we are supposed to do when it happens. Commonly, eye injuries just mean wounds or trauma to the eyes. Just like any other part of the body, the eye can get injured by different causes. Particularly in our environment, we have peculiarities. And there are different types of eye injuries depending on the cause. I don't want us to go into the different types because that one may sound technical. So we'll talk about the causes of eye injuries. Common things occur commonly. The cause of eye injuries in the environment, we can say, should be road traffic accidents, and they can occur in different forms. Other things that can cause eye injuries could be domestic accidents, even domestic fights, husbands fighting wives, and now we have clashes all over Nigeria, communal, religious, or name it. This can cause eye injuries. And then games, different games, plays, like in the house, you have what we call the broomstick injury. Broom is something we take for granted. Children play with it. But you know these rubber bands we use, the one we use in tying notes, not dollars but naira. If you put a broomstick into it, it turns into a missile. And when a child shoots it into another child's eye, it could be dangerous and can be blinding if care is not taken. Then we have all our workers, factory workers, people working in factories, soap, or even breweries. They deal with chemicals, and any of this entering the human eye can be very injurious. Then we have our welders commonly, who don't protect their eyes despite the devices provided. They can easily get injured. The one common thing is even farmers, you can get injured in the farm and from different mechanisms, sticks, or even some animals like snakes spinning into somebody's eyes that can cause injury also. But the most important thing is, what do you do when this happens? If a child has an injury, maybe from a broomstick, it is an emergency because the broom is very dirty. What you use to sweep everywhere in the house, including toilet. Imagine where that gets into the eyes. So also it carries with it infective organisms. That eye can go blind in a very short while if care is not taken. Or somebody working in a soap industry. Or electricians, when the battery explodes, it can be terrible. Imagine where an acid gets into your eye, or narcotics from soap or soda gets into the eyes. It can injure and cause blindness. We can't talk about the road traffic accidents, particularly where you sit in a vehicle. And in this environment, where human beings travel with animals, I've had cause to treat somebody who got injured from a cow horn. Imagine where you take a ride in a vehicle carrying cows. What do you expect when the cows go fighting? Eye injury, and that can be blinding on the spot. So we have to, there are many of things that can blind our eyes. Communal clashes. Well, we don't use den guns anyway for communal clashes. The Fulani herdsmen invasion, they now use sophisticated weapons, and that can injure the eye, and that can be blinding on the spot. And then these days we have some of these bottled drinks. They are bottled under high pressure, and when we open them, particularly with unorthodox means, with style, then the cork goes off. And some wines are bottled under very high pressure. When the cork goes on and hits the eye, it can cause eye injury, and this can be blinding even on the spot. Even the games we play, tennis, and those of you who play squash, you know what effect it will have. If a squash ball hits your eye squarely, what it does is that it can rupture the eyeball, it can cause serious bleeding into the eyeball, it can cause the pressure in the eye to rise, and can be painful and blinding all at the same time. But what do we do? What we have to do is, in the eye injuries, the most important thing is preventing its occurrence. Because once it happens, even the treatment may not be very reassuring. More so, we usually come very late to hospitals. And when we get injured, first of all, we try one or two things before doing the actual thing. Some of you here try babalawo, go to the chemist shop, they mix drugs. By the time you see the doctor, it takes days, and a lot of harm must have been done. So what we have to emphasize on is more of preventing its occurrence. Like in the house, don't allow the children to play unguarded. Watch them playing with brooms. All these rubber bands that you see them carry around, it's for binding notes and not for missiles, as the children use it. Once I see it among children in my house, I take them away. Workers should wear protective materials. Welders have their protective goggles, which they rather wear on the head than on the eyes. People working in factories, big construction companies, they have their headgears, they have their eye gears. Nobody uses them. The same thing goes for people in soap industries, breweries. There are plastic goggles they have to use, but they don't use it. Even our Okada riders. Imagine where you're on Okada in the night and an insect flies into your eye, reflexly you close the eye, and a lot of other things can happen. We don't advocate fighting, but where you must fight, go and get a protective goggle and be ready for a real fight to protect your eyes. Because a direct blow to the eye can be quite dangerous. Whether it comes from the man or from the wife, it should be avoided. Then, these days, we have new trends. Our women are now having what we call the artificial lashes. What do they use to fix these things? Super glue. And those who wear glasses and repair their glasses with super glue is very dangerous. When it gets into the eye, it can injure the eye. The lids can stick together and may be difficult to open. Opening them means tearing the eyelashes, tearing the eyelids, tearing the eye contents apart. And we should avoid that. So women who fix the eyelashes with glues, woe betide you the day the thing gets into the eyes, because that eye may be glued to the extent that to open it may require the services of an anesthetist. We have to be careful. Now that we're talking about communal clashes, I mentioned the Fulani herdsmen who now go with sophisticated weapons. It is no more the fight of bow and arrow, but AK-47. We now have AK-49. I wonder what that one will do in Nigerian environment. We have to be cautious. And when it happens in the dead of the night, God save whoever gets the eye injured, because there will be no attention until day breaks, if any will ever come. Because by then the herdsmen must have been miles away. We can go on and talk about what causes eye injuries in our environment.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
When you drive your vehicles, the protective belt is there for you, but we only wear it because we want to appease the road safety man. If you have an injury and you fly out of a vehicle, hit the screen of your car, the glasses will not save your eyes. Imagine where you have pieces of glasses tearing eyeballs apart. It could be difficult to repair. We still talk about prevention. You can see that in eye injuries, it is better prevented than allowing it to occur. Then if it does happen, what we have to do is quick action. We don't go to hospitals in time, that's our problem. If you work in a factory and chemicals splashes into your eyes, for goodness sake, look for the nearest source of clean water. Irrigate your eye, whether in a tub, whether in a bowl, as many times as possible, to wash off the chemicals and to reduce the irritants as well. Then watching children play with broomsticks and other missiles in the house should be avoided. In school, children should be supervised, particularly when they go out of break. And for those of you who still use whip to correct the children, both at home or in the school, please avoid the head area, because any injury to the eye is final, and we usually very regret it after we must have caused injury to our children's eye. Imagine you blinding your child because you want to correct that child in the name of not sparing the cane to spoil the child. Avoid the head. The buttocks are large enough for you to flog on.
Sighted.
Counter-quick injury in tennis playing, in squash particularly, because squash is firm and small and can easily fit into the opening of the eye and can damage the eye at the slightest opportunity. So, gentlemen, we can go on and talk about it. One thing again is, if we are injured, please, for goodness sake, visit the hospital as quickly as possible. Nigerians are latecomers in every aspect. Nobody ever goes to the hospital on time. And the eye injury, of course, they believe the chemistry will do something. And also, there are some eye drops that can be injurious to the eye, particularly when wrongly applied. Because once you go to the chemist, they must give you something. You can't live there without anything. Be careful what you put in the eye, particularly as a first aid. You have eye care workers all over the place. Go and get counseling. Get the first aid treatment before you go finally to see a specialist regarding your eye, particularly when you are injured, no matter what kind of injury you have in the eye. Another thing amongst our farmers, I've seen men treat eye injuries with urine. You may laugh, but it's true. I've seen them. A farmer gets injured in the eye while in the farm. What he does is look for a leaf, form it into a cup, urinate into it, and pour it into his eyes, because his forefathers told them that it is healing. It is not. Imagine what to do. The urine you are sending out is a reject from the body, and imagine it contains a lot of infectious materials. You are now the one putting it back into your eye by inoculating a clean injury to the injured area of the eye with an infected, dirty urine from the body. It's unacceptable. And there are certain leaves, particularly in this environment, they tell you squeeze it when you have an injury, put the fluid into your eye. It is soothing and healing. It is very wrong. You don't know what you're putting into the eyes. It may end up causing you more harm than good, which will be very, very costly. Once you have an injury to the eye, please go to the nearest health center or hospital and get the appropriate attention. And also, please look for those who are specialized in eye care deliveries. Not every part, for goodness sake. I wish you well.
Wow! It does appear that all around us we are surrounded by things that can potentially injure our eyes. But then what do? We only need to be watchful. Precautions. We need to be proactive in preventing eye injuries. We're going to go over now to watch a short drama clips on causes of eye injury. But let me tell you one thing. Most of the ones we're going to be outlining, or most of the causes of eye injury we'll be showing one after the other, are not just stories. These are events that have happened, or cases that have presented to the clinic again and again. Now we're going to go over to watch the drama clip. Please pay attention, as I said.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Well done, guy.
Well done, guy. You have to work fast because we are blessed with power holding company in this country.
I beg, let power hold their company. It's like the power of my eyes. Don't they hold now?
Bobo, what you mean?
Don't come, oh.
This thing don't come again.
Again, sincerely. I always have occasional aches on my eyes. What's on the right side? And even as I'm feeling now, I don't think I can continue with this job. And the owner will soon come to collect it.
It is Gary, my friend. You must have eaten a lot of Gary. I've warned you that Gary is dangerous to eyes. And if you want to enjoy your sight, you have to stop it. Let's pray. The owner, accept your usual apology. And you have to do something very fast to your eyes.
All of us will take Gary. You two they take Gary.
Look, continue taking it.
Yes.
If you don't drop it, you soon become handwork.
What is it you are sitting down again?
Prof, welcome.
Where is my gate? I've come to collect it.
I'm sorry, sir. I'm sorry.
Are you serious at all? How do you mean? Can't you see what you are pointing your fingers at is an uncompleted piece of metal?
Make no face, Oga. I have problem with my eye.
It is Gary.
No be Gary.
I dey tell him say me no drink am. Prof, please make no face.
Cassava flakes do not destroy the eye if it is well processed.
Wetin you say? Flake?
Gary?
Prof! Na Gary you give big name like that?
What is wrong with your eyes?
Oga, for the past 2 years now, I've been having problem with my 2 eyes. I also have this feeling as if sand is inside my eyes. Sometimes red, sometimes painful and difficult to work with in the bright light. And sir, as per your work, sir, please come back tomorrow or next tomorrow, sir.
Where is your protective device?
Protective device. Please, Oga. Come down to our level. All this big English, I know Shabi Amo.
I mean your helmet with protective goggle.
Bro. Hey! So the thing where they say Goggle, now you they give big name like that. Too much book they worry you. Waiting, Goggle got to do with his problem.
Engineer Dotun, please bring me your goggle.
Goggle.
Bro, sincerely, it's only the. I will soon finish it. I will finish your job.
You will see a goggle now, and you will see how effective it is to your job and protective to your eyes.
Our work is just to do that, nothing to do with goggle.
This is a protective goggle.
This is original.
This is designed to protect welders from the ultraviolet light that comes from the welding materials that can cause damage to the retina and the cornea, the 2 important and most sensitive parts of the eyes for sight. When you wear this, you are protected. So you must buy one immediately. Then you must go and see your doctor because your eyes are already discharging.
I can see.
You must buy a protective goggle immediately. The same way you protect your skin and your hands with these long sleeves and gloves, you too, you need to protect your eyes with the protective goggle so that chips from ions will not enter into your eyes. Understand?
Very, 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 very.
You must buy a protective goggle immediately. And I will come for my gate in the next 3 days.
Okay. Wait a minute. Wait a minute. I want to show you something. Though we have for the past 2 years now. This is the one we use, and this one you brought, sir. This type. The time when we dey learn this job, my oga use am. I don't know where he bring am, but my oga get am, and it's good. But the thing cost.
How much work will they collect? Where you take money buy this one?
When your eyes are damaged, what you spend will be more than this. So protect it right now and save your eyes. Clear?
Very, very clear. Prof, thank you very much.
That reminds me.
Okay.
There is a lecture on eye injury organized by an NGO in this town. It will benefit the two of you if you can attend. Here, these are the flyers. Take it, invite your friends, and make sure you attend. You will learn how to manage your...
How much, sir?
Free.
Free? Na free?
Finish my gate in 3 days. 3 days, I come for my gate.
Thank you very much. Thank you very much.
Okay, thank you, Prof.
Thank you.
Thank you.
Prof,
And
thank
what
you.
about the balance, sir? Prof.
You could buy Goggle.
If you bring my balance, if you bring my balance, why not buy
If you
Goggle?
no bring your balance, you no
I will not do.
Then your eyes will go.
Your own too will go.
You become Tangoli.
Your own too will go.
Your eyes will go.
Okay, now we
Go
try.
buy Goggle.
If it's only I say he's paying me. He's not paying me again.
You didn't hear what Prof said.
He's not paying me again.
Okay.
He's not paying me again.
Sabiola, continue doing your work.
Sighted.
All right, viewers, this is where we're going to put an end to this episode today. And I do hope you have learned one or two things from the video, from the drama clip, as well as from the interview. I am Feyi Adekwaji, your host on Sighted. Please, we want you to keep the interactions on our social media pages, and we'll keep responding to each of us, as we've been doing. Until next time when we meet again, keep taking good care of your eyes.
I will advise you to keep watching Sighted for preserving vision and restoring sight.
Sighted.
Hello viewers, you're welcome to this edition of Sighted. Sighted is a sight educational program designed to educate every one of us on eye health issues. Today we'll be looking into a common condition, usually undiagnosed because the symptoms are not so marked. But then there are several people who have this condition, and we're talking about dry eye. To talk to us on dry eye today, it's Professor JFA Oweye. It's my pleasure to hand you over to Professor JFA Oweye.
A very common cause of blinding disease that brings patient to the eye clinic, which is called dry eye disease. Dry eye disease also exists in other names like dry eye syndrome or simply dry eye. It is a chronic lack of sufficient moisture and lubrication on the surface of the eye. All it entails is that we have a situation whereby the surface of the eye is not adequately lubricated. Simply put, dry eye disease is a chronic condition whereby there is inadequate lubrication of the surface of the eye. For good vision, this part of the eye is referred to as the cornea. It is a transparent part of the cornea, of the eye, and is responsible for about 60% of our ability to see. For better vision, the eye needs this part of the globe, which is called cornea, to be as transparent and as clear as possible. And for that clarity to occur, then the surface of this cornea needs to be moistened constantly. This is what happens when we blink, because each time we blink, then the eyelid will move a tear film across the surface of this transparent part of the eye, and it keeps it moist, thereby allowing the cornea to do what it's supposed to do. But we have situations whereby either the quantity of tears that is produced is small, is not adequate, or even the quality of that tears is also not adequate. When either of these happen, then we have on our hands a situation referred to as dry eye disease or dry eye syndrome. The tear film I talked about just now, actually they are in three parts. The outer part of the tear film acts like a fat layer that reduces how fast the tear, the aqueous part of the tear, gets dry, in the eye. We have a middle layer, which is the watery part of the tear film, and we have an inner layer, which is like a cement that will attach the watery layer, and that fat or lipid layer attach it on the surface of the cornea. The thing is that these three parts of the tear film, they are secreted by three different parts of the eye, and any of these, deficiency of any of these three layers will result in what is called dry eye disease. Like I said, dry eye disease is a chronic lack of sufficient moisture and lubrication on the surface of this transparent part of the eye called cornea. Many things can lead to a dry eye disease. Like I said, different parts of the eye are responsible for producing different types of the layers of the tear film, which means the oily part, for instance, if the part of the eyelid that is responsible for producing that oily part is deficient, it's quite possible that we only have two parts of the tear film, and the oily part that is missing would be a source of dry eye. The truth is that the oily part is responsible for minimizing the rate at which the tear is evaporated from the eye. It serves as a shield for the watery part of the tear film. Once that layer is absent, then it means that as much of the water produced would get out of the eye faster than necessary. If the middle layer, which is the watery part, is also not adequately produced for 1001 reasons, then it means that the aqueous component of the tear film will also be missing. If the inner layer that serves as a plaster or a gum on which the other two layers are resting is also not adequately produced, it means that even if the first two layers are there, then the tear will still not stay on the cornea. The dry eye disease could arise from even the daily activities that we do. Say for instance, you are looking at a computer, laptop or smartphone for a very long time without blinking. It's enough to give rise to a situation whereby someone will develop a dry eye disease. A disease affecting other parts of the body could also lead to a situation whereby an individual will have what is called dry eye disease. For instance, diabetes mellitus can lead to a situation whereby someone will have dry eye. Diseases like thyroid affecting the eye will lead to a situation whereby someone can also have dry eye disease. We have instances where a gland that is supposed to produce the aqueous part of the tear film is also deficient. This one can also lead to dry eye disease. There are some medications that if you use, maybe for a different thing, can also have its effect on the rate of production of tear or even the quality of tears that is produced. Even drugs for treating something as simple as itching in the eye could predispose to dry eye. Other drugs that are used in other areas of medicine could also lead to dry eye disease. Diseases also like rheumatoid arthritis could also predispose an individual to developing dry eye. Apart from these diseases that I've mentioned, even the home environment where we stay in can predispose an individual to developing dry eye. For instance, a ceiling fan or even a standing fan that is moving at a very high speed could cause a very fast evaporation of the tear film. This way, predisposes an individual to developing dry eye. It's the same scenario that also plays out if you are in a windy environment. A fast blowing wind would make the eye to get dry faster than it should. Even when you are increasing age, for instance, has also been found to be a risk factor for developing a dry eye disease. You will find incidence of dry eye disease more in elderlies than you will find in younger ones. But remember, even the issue of using of a smartphone or a computer that I mentioned earlier, which cuts across all ages, is such that even the rate at which children now or young people will present with dry eye disease is more than what it used to be in the past. Also, even you are driving inside your car without the AC is blowing directly into your face, is also another reason, another risk factor for developing dry eye. Some surgeries too, though often this could be a transient thing. Some ocular surgeries could also, as part of the complications, present in form of dry eye. So these are the factors that would predispose an individual to having what is called dry eye or dry eye syndrome. Now, when dry eye develops in an individual, symptoms like itching, symptoms like redness of the eye, symptoms like watering of the eye, symptoms like red eyes. Some will complain of foreign body sensation, as if they have stones in their eyes. Some could even complain of blurred vision. The blurring now will arise if the corneal surface here becomes too dry. Then it can start losing its transparency and to be a form of blindness. All these symptoms are common in people who have dry eye. If there is a situation where you have dry eye syndrome, the tendency will be to prescribe something as a replacement for the tears that is not sufficient on the surface of the eye. So it's not uncommon that when you present at the hospital, the prescription would include an artificial tear that will help in lubricating the surface of the eye. But there are things we can do as individuals, even without having to use things like an artificial tear. For instance, the use of computers and smartphones. It is advised that when we have used a computer or a smartphone, so for about 20 minutes continuously, it's advised that we should take our eyes off this equipment for about 20 seconds and look at a distance of, say, about 20 feet away from the computer. We call it 20-20 rule. You have worked for 20 minutes in front of a computer. Take away your eyes for 20 seconds from that computer and look as far as about 20 feet away from the computer. This way, it's believed that you will be able to, rest the eye and blink normally instead of staring at the screen of a computer for that whole period. And in the process of blinking, then you'll be able to move tear films across the surface of the eye, across the surface of the cornea. Again, a think blink approach is something that we should also incorporate, such that we are doing something consciously. Remember that you need to blink so that you'll be able to move the tear film across the surface of your eye. Another thing is that we have individuals that the rate at which the tears exit their eyes is so fast, faster than the rate at which the tears is produced. In such instances, we can actually plug those openings on the eyelid where tears will exit the eye. We have what you call plugs. We have plugs that you can use to block those parts of the eyelid where the tears will exit the eye, so that you can have enough tear on the surface of the eye longer than necessary. That way, you now have the corneal surface moistened for a prolonged time. Again, if we know that a patient who presents with dry eye disease is on a particular medication that could predispose him to developing a dry eye, the dosage and the frequency of this medication could also be modified such that you'll be able to achieve a balance between keeping the eye moist and at the same time, achieving the therapeutic effects that you want from the use of such medications. So these are the things that individuals can do either on their own or on the instruction of their doctor to minimize the damaging effect of dry eye disease on the eye. The truth is that if the cornea surface becomes dry for a longer period than necessary, it's a cause of blindness. And blindness in this instance could be irreversible.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Welcome back from that interview segment on dry eye by Professor J.F.A. Oweye. Now we're going to go on to watch a short drama clip. It's still on eye injury. As I said, we can't exhaust all the possible means by which these precious pairs or precious eyeballs God has given unto us can be injured. Please enjoy the viewing.
Sighted.
Who be that?
Nami Okono.
Ah, Papa Okon.
Madam.
How you doing now?
Madam, good evening.
Don't tell. Sit down, sit down.
Now, Oga, what happened now?
Okon, you know see me so now Apollo.
Abazimba. Now Apollo be that?
It has been disturbing me since morning. In fact, I cannot even go out at all.
See, why they waste them now?
I've used eye drop, but the thing is you have to see how this thing is paining me.
You go use onions now, you go cure them. Use beetroot, you go to cure them. You go eat salt and water now, you get them for house. You go cure them. Even battery water.
I
bet that one come in now.
Okay.
For eye. No.
Battery water? Inside my eye? No, I can't use that one. That salt and water, I think is better. Is easier.
Madam, what do you wait for now? Go bring salt and water.
That's the battery.
Please help me to get water and salt.
Some are using petrol. Some are using battery water.
I tell them now.
Some are using onion.
I tell them.
And all those things are very dangerous to your eye.
Dangerous to my eye?
In fact, seriously.
But whether, what do you want to suggest? I think, how can I get this thing off my eyes, please?
The only thing you need to do is for you to visit any eye doctor to treat your eye.
Ordinary Apollo.
That is their job. Even if your eyes is just itching you like this, take it to them.
Okay, that one na waste of money now. No, no, say na recession with it.
It might be expensive, sir, but the damage that will cause to your eyes will be more expensive. If you are using all these things, sir, you are writing a letter to blindness.
Oga, wait. So maybe this thing feel blind in eye?
Yes, immediately.
You don't go see
Again.
Hey, okay, I better take your salt and water away. I'm not using again.
Okay, neighbor won't help you now.
I know, but you can hear what the weather said. He said that this thing is dangerous to my eyes.
Okay, me say
better for me to take it to eye clinic.
No, me say bring the
in fact,
no fakes now, okay?
No, I know vex, but you hear what the weather said. Thank you very much.
Okay, let us put that one aside. I come for material money as we agree.
Okay, for the wedding or okay. Just I'll give you one paper now to write your account number, so I will transfer the money to your account.
Okay.
In fact, I'm very grateful for
Thank you. I cannot shake you, sir.
Why not?
Very contagious, sir. And even your handkerchief, wash them well. For any eye problem, consult your eye doctor.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Stop it! Hey, oh yeah, move back. Oh yeah, Nida. Yeah, close your eyes. Can you see me standing in front of you right now?
No, sir.
What did you see while closing your eye?
Nothing, sir, but darkness.
Open your eyes. Oh yeah, stand up. That is what you will all see when one of you injure yourself with the stone you are throwing. And you will end up not eating the cashew, and you will lose your eye. Huh? I don't know that yeye long throat that worrying you people. You supposed to be in school, Gansef. What do you do at home? Oh yeah, go inside and read your book. What boju ara wọn jẹ́?
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Mama Ngozi, what nonsense is this? Don't you have manners? You are a fool. You are incorrigible. How will I leave the house since morning to come back and meet an empty pot and bread? What nonsense is this? See, the train that your pa did not give you at home,
What is the problem? Open the door.
You call me Anofia.
Yes. Yes. Yes.
You are a fool. You are a madman.
Hey, Mr. Chinedu, stop! Open the door. Open the door. Open the door.
You are very stupid.
Hey, stop! 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 Stop it! Madam, stop it! What is it? Mr. Chinedu, what is all this nonsense? You are fighting your woman. It's very bad now. Sit down. Sit down. Mamangosi, don't do what you later regret tomorrow. You will kill your husband.
Let me kill him. Let me kill this useless man. Leave me. He will leave home his money. He won't leave money for food. He will now come back, beat me up when he return from his push up animal.
If you hit your husband in a dangerous place, particularly his eyes, na blindness be that oh. And remember, your husband is the father of your children. Stop all this wahala. Stop all this yes, shouting. Baba Ngosi, enough is enough. A word is enough for the wise. Ngosi, don't let me hear your voice again. It's okay. Oya, go to bed. Oya, go to bed. Baba Ngosi, don't let me hear your voice again. No. Oya, follow me. Come to my house. Come.
Chinedu, you slap me. You will regret it.
Well, viewers, welcome back. And again, we have seen another trick from ASCII talking to us on how the eyes can be injured. Well, this is where we're going to put an end to this segment of this program today. And I'm sure you have had several things to learn along the line. Keep getting back to us on all our social media platforms. And we actually are encouraged by the volume of the correspondence and your questions and comments, and particularly suggestions on how to improve and make this program better for all of us. Keep watching Sight Ed, preserving vision, restoring sight. See you next time.
Keep watching Sight Ed, preserving vision and restoring sight. Is an educational program meant to educate the populace about eye health. And I believe you will enjoy watching the educative program.
Well, I want to welcome you to another edition of Sight Ed, a sight educational program designed to educate every one of us on eye health issues. I remain your host, Feyi Adepoju. Today we're still going to go on looking into details, certain aspects of ocular injury, because eye injury is a very, very important cause of ocular disorders. And not do they only have immediate effect, they can have a long-lasting impact on the individual, on the community, and the nation at large. To take us further on eye injuries and how we should be able to handle cases of eye injury, we interviewed Dr. Anyoniyi, who will be focusing more on the effect of ocular injury, and particularly at the concluding end, what should we do as first aid if there is a case of ocular injury. We do hope you keep on with this program. Sight Ed is about preserving vision, restoring sight.
The effect of ocular trauma are quite great. I would like to divide it into a number of areas. The first one is affectation of the visual function. Then it has cosmetic or disfigurement implication. Aside that, it can also have far-reaching implication on education, economy, among others. Then I start with the visual function implication. First, it can affect the visual acuity. What do I mean by visual acuity? The extent to which one can see into the distance. The severity of ocular injury can cause diminished vision, or it can totally wipe off ability to see. So when that occurs, the implication is quite great on our daily activities, on the quality of life in totality. Then the second aspect of the visual function is what we call visual field. The extent to one can see into the space in general is what we call visual field. Like the two eyes, they work in pair, and then the extent to which each eye can see, when one eye is already affected or is diminished, it affects the total visual field. That is another way by which the ocular injury can actually affect visual function. The other one is what we call a depth perception. We are able to judge the depth of maybe somebody is walking and is about to cross a ditch. You want to judge how deep is that ditch, or how deep is a river when one is walking. So all those ones will be affected when one is having diminished visual acuity, diminished visual field, when one is having ocular injury. Then secondly, when we are talking of disfigurement, you know, the eye is an organ of beauty, though the primary function of the eye is ability to see properly, ability to observe what is known as visual function. Some of them I have mentioned initially. When there is disfigurement, then to a large extent, the individual affected will be affected psychologically. In children especially, their peers in school, they may make jest of them. You know, children, they can't hide anything. They can say you with, see the eye, see how your eye is. You are not even looking fine. Some children may tell their peer that is having eye problem from ocular injury like that. And then you see the way that child will be depressed. In fact, children with unstable mental state may even attempt to commit suicide. Or some of them, they may say they don't want to go to school again. It's a serious effect. But in adults, generally, it physically it reduces the worth, what I can call the worth of that individual. A young lady with visual disfigurement may automatically screen herself out of participating in certain beauty competition or something like that. So those are serious effects. When somebody is having ocular injury and then that particular eye is now, there is reduction in size of that eye, or there is a disfigurement scar, a very nauseating scar, which can be shown when somebody is looking at that individual person. So such individual person may suffer from what we call low esteem. He will not want to associate with her peers. If they call her to attend a particular something, may be trying to dodge, because the way she looked before, she's no longer looking like it. So it's a serious problem. It can lead to mental instability and then depression, and then you know what depression can cause. It can cause people go to extent of committing suicide. Then the other effect of ocular trauma may be in terms of career choice. Somebody who is having ocular trauma, maybe now there is reduction or impaired vision in that particular eye. Such individual may not want to choose a career like pilot, military, among others, because all those career or vocation, they require functional two eyes. It can actually cause low educational development, because if such individual is unable to see properly, the ability to function well in the classroom, ability to read the way he's supposed to read may actually be impaired. So it can actually affect the educational development of individual. Then generally, when we are now talking of economy, you know, the economy, we carry out our daily activity to generate money, to generate a lot of things. So if somebody is now visually impaired from ocular trauma, then ability to work may actually be impaired. So what you call gross domestic product generally of the country may be actually affected, because the production from individual, if we have so many people with eye trauma, with reduced or impaired vision, they will not be able to contribute their best to the economy. In fact, some of them may end up begging for money and become liability to the society. So it will be a great economic loss to the society, aside from the individual and family.
Sighted, an educational program on eye health issues.
How to take care of our eyes, the problems that can occur with the eyes, and what we should do about them.
Interviews.
Glaucoma is the commonest cause of irreversible blindness.
Educational drama on eye health.
Check your eyes before you become a victim of glaucoma.
Practical questions and answers.
The effect a wrong pair of glasses will have is that you will be uncomfortable as the user.
And lots more. Sighted.
Preserving vision, restoring sight.
Sighted.
Whenever anybody have ocular injury, we should endeavor to take that individual to the hospital. But before we go to the hospital, there are a number of things that we can do at home, in our office, at workplace, even on the road. Okay, let's take instances. If somebody, maybe he has a chemical injury in the farm now, some farmers use herbicides. If perchance, while they are applying the herbicide on the farm, some of them, when they are spraying it, enter their eye, they should get clean water and wash that eye properly, thoroughly. And then the next thing is to present at the nearest hospital immediately. Then as soon as somebody has acid bath, maybe from a strange partners, which we often see in the hospital, or somebody is trying to play funny, somebody has acid injury, what we supposed to do immediately is not to start crying. We should use available water, any drinkable water. We should use it to wash that particular affected area, so that we dilute the effect of that chemicals. That is the first thing we do. We use as plenty water as possible to wash it, and then the next point of call is the nearest hospital, especially where you know that you can get eye care specialists. So it's very important that we present at the hospital immediately to the eye carer who know what to do. Then aside from that, ocular injury in form of maybe the one causing through and through cut of the eye, we should try as much as possible not to apply anything, because once there is a tear or a cut into the eye, that is not the time we should now be saying that let's go and apply maybe all this traditional eye medication, or we go to chemist and apply medication. We should just try as much as possible to do little padding. If we get something to pad the eye or cover the eye, and then take that individual to the hospital immediately. Then as teachers, as parents, when children, when they offend us or they do something that is very nauseating, that make us angry, we should try as much as possible not to use cane. We should try as much as possible, because we have been seeing cases where when parents or guardians use cane, or teachers in the school, when they use cane, they end up injuring the pupil or the children's eyes. Then some of our artisans, like welders, blacksmiths, all of them, they should use their protective goggles, because while hitting metal on metal, some metal chips they may cut off and then hit the individual on the eye and cause damage to the eye. Then occasionally we have what we call solar eclipse. If we have urge to actually visualize solar eclipse, we should try to watch through the bowl by putting water in a bowl. We should not look at the solar eclipse directly. because the rays coming from the sun can actually damage the inner part of our eye. We call that area macula. It's the most sensitive part of our eye. The rays coming from the sun, coming from all this weather light, can actually damage the inner part of our eye. Then those of us that engage in sports, we should try as much as possible to use protective either goggles. Those who play squash, those who play contact sports, they should try as much as possible to avoid all those things, the ball or whatever, getting to their eye.
Sighthead.
You're welcome back from the interview segment with Dr. Abdulkabir Anyoniyi, talking to us on how to take care of cases of eye injury, at least as a form of first aid. So we're going to go on to watch a drama clip on ocular injury. As we've earlier said, these are live situations, they're not just story. So as you watch in drama, we need to keep knowing that these are events that can occur or have occurred in the past, but we don't want to keep seeing them occurring. Do have a good view.